Welcome to True Wellness with Dr. D, the podcast where we explore what it takes to live with vitality, balance, and purpose. I am Dr. D, and each week I'll bring you powerful tools, inspiring stories, and expert insights to help you thrive in every area of your life. From health and wellness to mindset and navigating life's challenges, this podcast is your guide to creating a life of true well-being. Let's get started. Hello, everyone. Welcome to another episode. I am excited to be here today with Dr. Layne Martin. So Dr. Layne Martin is a dentist and an orthodontist, and he is an airway and sleep specialist, which is why he's on speaking with us today, because sleep is absolutely crucial to our health and our well-being. Dr. Martin is the creator of Open Air Pillow and Ayurveda, which I'm sure you're going to share with us about those things today. So welcome, Dr. Martin.
Thanks for having me.
I'm glad to have you. Why don't you tell us a little bit about how you went from being a dentist and orthodontist and then into this space of really promoting airway and being an advocate for sleep?
Yeah, so I really love sharing my story because I kind of think it shows how I got from dentist to ortho to where I am today. So I was in the Navy, got a scholarship for dental school, had a great career in the military. I got out, I moved to Manhattan. I ended up joining a boutique dental practice. And I was doing like very extensive cosmetic dentistry, work with some amazing specialists. One of them in particular is a gentleman named Jim Jacobs. He was a gum specialist. And him and I started doing a lot of cases together. And he's like, I want you to take your skills to the next level. And at that point, I'm 37, 38. And I was like, wait, I'm not at the next level. And he's like, you're not even close to the next level. I end up going to a continuum in Seattle and finishing the continuum, realizing I know nothing about dentistry, really lacking, I think, a lot on education. And one of the gentlemen that I taught with out there, we would meet once a month in New York City to discuss very complex cases. And every time we would show a big case, he'd be like, they have an airway problem. Next case, airway problem. I'm like, dude, you're getting on my nerves. What the heck are you talking about? And after about the 50th time, he starts explaining it to me. And I realized like the things that we see in dentistry every day, worn down teeth, narrow arches, retruded jaws, they're really the signs of an airway problem. And I missed these things for 15 years. Okay. So I end up doing all these airway residencies, and I'm able to recognize the problem, but I don't know how to fix it. So I think really in medicine and dentistry, we fix symptoms, right? Someone breaks a tooth, you put a crown on. Someone has high blood pressure, you give them medication rather than figuring out like what's the root cause. So the more that I did research, I realized that at the time I thought orthodontics was a way to fix the problem or cure the problem. So long story short, I sell my dental practice and I go back to school at the age of 42 to do an orthodontic and craniofacial orthopedic fellowship. And everything was great. I'm like, all right, I'm going to become this like amazing airway orthodontist and I'm going to cure this problem. First off is snoring and sleep apnea in adults. It's an incurable disease. It's like diabetes. Okay. You can manage symptoms, but you can't cure the problem. With diabetes, you can give insulin, diet control, medication. Sleep apnea, it's really CPAP or like an appliance like we developed. But while I was in my orthodontic fellowship, a patient of mine who was 50 died, and he had sleep apnea. And I kind of was going back where another one of my patients, my friend Dave, 40, also died of sleep apnea. And he had all the signs and symptoms of someone with an airway problem. So I don't love the term sleep apnea because I think the metrics are a little off. But when Dave was at my office, he snored, high blood pressure, acid reflux, but his teeth were broken. His teeth were worn down and he was clenching and grinding. Well, the other patient, this gentleman, Ron, same symptoms, snored, high blood pressure, acid reflux, worn down teeth. The problem with Ron, though, was when I treated him, I was already trained in Airway per se, so I knew he had a problem. I fixed his teeth, and then I told him to go get a sleep test, and he never went. And I think that's when I was like, all right, if it's happening, and it was happening in my office, it's happening in every dental office in the country. The problem is snoring and sleep apnea in particular, it's never on a death certificate. But it's heart failure, it's stroke, it's all these other comorbidities. So I ended up going to Tufts to do a fellowship there. I took my dental sleep boards, and then I started lecturing around the country. And I was like, I need to be better at this. And someone introduced me to Bo Eason, and that's how you and I met. And I went there. And that was kind of a game changer for me because I was kind of another cog in the wheel, and going out there really pushed me to a point to do what I'm doing today, which is kind of being an entrepreneur, speaking in front of larger groups. And, you know, I was at a meeting recently and I saw one of my mentors and he's like, I can't believe you're not in private practice. And, you know, you were so good. And I walked away and I was like, you know, should I be back in practice where I could touch 1,000 people, or should I be doing what I'm doing now where I could touch 200 million people? And I think that's really the story. And I love working with people like you because it's looking at other things rather than, all right, let's just give them medication and like kind of cross our fingers. Because I mean, I look at the 3 pillars of health. It's nutrition.
Yes.
It's exercise. And I'm going to tell you, I think sleep's the most important part of all of those.
Yeah.
And that's kind of why I'm doing what I do.
Yeah, I love it. Let's talk about sleep and let's get the audience to understand why in your book is sleep such a critical thing. I mean, I think we all know at some level, but when the research, the study, the work that you've done, you've really honed in and pinpointed like, okay, when we're not sleeping well, we are having some pretty serious symptoms that are occurring. So the body is compensating for that sleep and the results are not good, right? What happens, Dr. Martin?
Yeah, I mean, well, you hit it on the head. Compensation is a key word that we tend to use all the time. I mean, the questions I always ask patients, and it's really for anyone, whether they're healthcare providers, they're talking to friends, are you aware that you snore? I never ask someone if they snore. It's somewhat accusatory. I'm trying to break that kind of stigma. Are you aware that you snore? And could you be more refreshed? I got to tell you, Danielle, I don't know anyone that wakes up is like, man, I slept amazing. Like I could go run a marathon.
Right.
I rarely see that person. So the issue is, what do we do? Caffeine, right? I mean, I'm at fault for it. Sometimes I don't sleep well. And it's the same thing. Your body needs sleep, right? We're the only kind of mammals that really require that type of sleep. Now, what happens if you have an airway problem? Well, in kids, we talk about things like ADD, ADHD. I would even tell you sometimes kids with autism. What happens is they're not getting oxygen to their brain. In adults, it's brain fog. And really what's happening now is the biggest cause of Alzheimer's in our country, a lot of it is sleep apnea. And what happens is, you know, the best analogy I could use is when people are in fight or flight.
Yeah, when they're
that's real. Well, that's really what's happening while you sleep. So I always give the analogy. I mean, we lived on Long Island. You're speeding on the LIE and you see a cop on the side of the road. And all of a sudden you blow past the cop and you look in your rearview mirror and you see the cop coming. What happens to your body when you see the police officer? Your heart rate goes up, your blood pressure goes up, and you clench down. You go into fight or flight, or what we call sympathetic overdrive. So now what happens is it's depleting oxygen from non-vital organ systems, also taking it away blood supply from your extremities, and it's got to go to your heart and your brain. Well, think about how crappy that feels for the 20 seconds when you're like, oh my God, I'm getting pulled over. Well, with someone with an airway problem, that's happening 200 to 300 times a night sometimes. Think about the stress it could put on someone's heart, their blood pressure. Forget about controlling their blood pressure. So when I see patients that are on multiple meds for blood pressure, one of the first things I go is sleep apnea. Every one of my patients, acid reflux. Now, why is that important? Because what happens is when you go to sleep at night, your parasympathetic nervous system takes over. That's the rest and digest.
Yes.
When you digest food in this direction, when you deplete oxygen and you're in fight or flight, now all of a sudden it's taking oxygen, like I said, away from non-vital organ systems. So reproductive tract and digestive. So now all of a sudden the food can come back up. Yes. Now it gets exacerbated when you lie on your back and your tongue falls back, and then it causes suction. And now also the acid can come back up. So it's a little bit of twofold there. So I look at a lot of it like comorbidities, like, all right, does the person have an airway problem? Now I say airway problem because I took a sleep test. Now I was tired all the time. I was snoring and I would need coffee by 4 or 5 o'clock. My sleep test came back totally normal, but I was definitely not normal. I was tired. So I have what's called upper airway resistance syndrome, which a lot of people have. It's just that our jaws are too far back. We were not breastfed. Now, breastfeeding is super, super important. Obviously, there's a nutritional value, but it's really about the functionality of it, of helping form your craniofacial, helping form your face. The other thing is hard foods. So like I wasn't breastfed and I didn't grow up eating hard foods. So my jaws just never developed properly. And I was a sick kid that ended up becoming a sick adult. So a lot of this stems really from kids. And what we talk about is really intervening early with kids.
Okay, let's talk about that. So you said a couple different things that I just want to touch upon and highlight upon. So number one is that there is a purpose and function for breastfeeding, and a purpose and function for, we live in this processed food world, right? We're feeding babies all this mushy food. When what you're saying is we need to be actually chewing on hard food, starting from even when we're super little.
Yep.
And this often gets overlooked because if we're really going to get things at the root cause, we've got to go all the way back to when those kiddos are born, or actually go back to mom's nutrition as mom's growing up and preparing her body for the baby. But how do people know that they've got airway problems, right? How do the listeners understand, like, I wonder if I've got that airway problem? What are some of the things that they should be looking for?
Well, let's focus on kind of my world, at least for a little while, dentistry.
Yes.
So one of the things that I mistreated, and it wasn't what I really understood until someone pointed it out to me, is people that grind and clench their teeth.
Mm-hmm.
Now, yes, could it be that their bite is contributing to it? I don't know, maybe. But it's always the answer that lay people, and a lot of times I would use it, stress.
Yes.
Unless you have a neurologic problem, very few people really grind their teeth. What's happening is that's the fight or flight of them kind of gritting down and doing it. It's really a protective mechanism. So for dentists, when we see people that have really worn down teeth, I'm already thinking, all right, they have an airway problem. They're compensating, and it's the same thing. We get trained in CPR. So when I go to a dental office and I tell hygienists and dentists, when you see people that have wear on their front teeth, they're doing CPR on themselves. They're bringing, right? How do you treat a trauma patient on the ground that doesn't have an open airway? And you have to open their airway. You jaw thrust them. Remember that from CPR? So basically, if someone has an airway problem, they're doing this. Their lower jaw is too far back. When your lower jaw is too far back, your tongue is too far back, and you need to bring this forward. The other thing is, especially kids that get frequent colds, sinus issues, the roof of your mouth is the floor of your nose. So we're born as obligate nasal breathers. We become the habitual mouth breather. That's a huge problem in this country. We're all mouth breathers. Instead of us growing out this way, we grow vertically. So people that have like gummy smiles, when you smile and you show a lot of gum tissue, a lot of times what happens is you're growing vertically rather than if I show you the skull of a caveman, they're like this. So people with crowded teeth, right? Like crowded teeth to me is crowded airway. People that have a significant gag reflex, there's no room for their tongue, or their tongue is scalloped, or there's certain angles of what their teeth look like. So on the dental side, it's that. On the medical side, it's other comorbidities. It's sometimes hypertension, it's acid reflux, it's anxiety, it's depression, it's urinary problems. Sometimes it's having things like diabetes, not being able to lose weight, right? Because sometimes what happens is our leptin and ghrelin levels, which are hormone levels that control your appetite, get really thrown off when you're depleting oxygen to your brain.
Right. So your body's in this constant state of stress. Now you've got the high cortisol, and now your blood sugar is regulated, and your body's holding on to weight, and you're not making any changes.
Yeah.
So it's interesting because we have, and you alluded to this before, but we have this stigma around snoring, right? Like snoring is like this bad thing, and not bad in terms of people aren't necessarily thinking health consequences as much as sometimes I think they're thinking about embarrassment over it, which is why they're not talking about it. But let's be real, from what we're covering right now, if you snore, it's a big red flag that your health is impacted.
It's definitely a red flag. I mean, listen, there's a lot of people that snore that I snore and I have upper airway resistance syndrome. I don't have sleep apnea, but I definitely have an airway issue. So what happens with snoring is a lot of times it's from our soft palate. Our soft palate could drop or it gets elongated. The back of our throat, our uvula can get elongated. Sometimes it even gets kind of sucked down your throat from snoring, the suction. And your tongue is too far back. And a lot of that contributes to the snoring sound and the vibration. And yes, is it potentially a comorbidity with apnea? It could be, but it's really an airway issue. And that's kind of the world of where I'm at. And then the mouthpiece that I developed, my partner and I developed it. He's a famous TMJ specialist. His name is Michael Gelb. And we were looking at all these appliances when we started this journey, and we figured, let's get something comfortable. We used his and his father's intellectual property, and we basically created this mouthpiece, and we got FDA cleared this past year, which is great. Yeah, that was a huge battle. However, people still fail on our mouthpiece, and they still fail on CPAPs because of position. So what happened is the pillow that we developed was out of necessity because people should never lie on their back. Okay. If you lie on your back, gravity takes over and your tongue falls back. And that's what we were saying before. That also contributes to having an airway problem. Now, someone like me or someone that's in their 50s like myself and a lot of my friends, if we ever stayed on our back associated with an airway problem, we'd suffocate. Your brain kind of has you kind of move side to side. Yeah. You really should sleep on your side. Left side if you have issues with hypertension, acid reflux, and if you're pregnant, and right side for more of cardiovascular issues.
So I'm going to take 3 steps back here. So number one, you alluded to, so you've created a mouthpiece. So this is kind of like a different than a CPAP machine. This is something that rests in the mouth when you're sleeping, designed to keep your tongue from falling backwards. Is that right?
Exactly. I have an example of it. I could show you.
You'll have to explain it for our listeners.
Yes. So it literally looks like Invisalign.
Mhm.
It's an upper and lower,
Mhm.
and it's connected. And the premise of the appliance, it just prevents your jaw from falling back.
Okay.
So it's literally an upper mouthpiece like Invisalign, a lower mouthpiece like Invisalign, and there's a silicone connector on the side, and it just kind of keeps your jaw forward, especially when you sleep.
And reiterate for us, Dr. Martin, why is it important to keep your jaw forward? So what's happening if our jaw is not forward?
It's all about your tongue.
Okay.
So if you and I are sitting here right now, and I had you say the sibilant sounds Mississippi and 66, and you hold your phone, you're going to see your lower jaw, which is called your mandible, a lot of times comes down and forward. So especially like, obviously, I know you, I've seen your teeth. I'm going to be critical. And I've said it to you where I'm like, listen, I think orthodontics would really help get your jaw in a better position. So really, the bottom part of our mouthpiece is called a repositioner. It's basically a lower gelb, which is named after my business partner. And the premise is it takes your lower jaw from being retruded or too far back and brings it pretty much edge to edge when you say those sounds. So you can even say it, if you say Mississippi for me.
Yeah, Mississippi. And all of you.
See your lower jaw?
Try it. So Mississippi. So we should look in the mirror as you're saying Mississippi, and they're looking to see where their jaw goes as they say it.
Exactly. So if you bite down on your back teeth for me, bite on your back teeth. Perfect. Now, when you say Mississippi in 66, and I'm watching it on the camera, watch what happens to your jaw.
Mississippi 66. So that's front teeth are moving backwards as I'm saying those.
No, your lower jaw is moving forward.
Okay. Yes.
So your upper jaw is fixed. So the only thing that moves is your lower jaw. So when you say those sounds, it's very important, because I would tell you, and I don't want to say that it's a controversial thing, but in my mind, a lot of times orthodontics, it's not just about teeth. Mm-hmm. It's really about brain development, especially in kids. And then also in adults, it's more brain fog, but it's really the airway thing. It's looking at these things a little differently and just treating them differently.
Okay. So that's one way for people to know if they say Mississippi in 66 and they look at the placement of where their teeth is, top and bottom, they can get an indication. So the mouthpiece helps with that while they're sleeping, but you also talked about your pillow. So share with us a little bit about the pillow. So the mouthpiece, by the way, just for our listeners, the mouthpiece is called the Airvata.
Yep. AIRVATA.com, and you can go take a look at it. It, like I said, it literally just looks like Invisalign, and it's a great alternative to people that can't wear a CPAP or are not compliant with the CPAP. I'm a huge fan of CPAP, which is the mask that people wear that are treated for sleep apnea. Yes. The only problem is you have to be able to wear it, and compliance is really the biggest thing here.
Yeah, you can have it, but if you don't use it, it's not doing anything for you. Yeah.
Exactly.
Well,
sorry, go ahead.
I have a lot of clients in my practice that do not like wearing their CPAPs. We hear that a lot.
Yeah. Well, and then the other problem, and it's people that are compliant with CPAP, they're great. The issue is a lot of people that have comorbidities with sleep apnea, or like I said, even the depleting oxygen from non-vital organ systems. Well, those are urinary, right? Like people have to get up and pee a lot. Yes. Sometimes that's kind of a red flag. So if someone's using CPAP and their CPAP is not titrated properly, or they're still having some airway issues, they're going to have to get up to use the restroom. Well, guess what? They take the mask off, and a lot of people take the mask off and they don't put it back on when they get into bed. Where they really need their CPAP machine is in that REM part of sleep. So our sleep cycle's in 90 minutes. So a lot of times I want them to really be dialed in at that second half of the night.
Yes, absolutely.
And when I talk about REM, our bodies are mostly paralyzed in that stage, the dream state of sleep, or else you'd act your dreams out. Well, that's where people really need the help. Because if all your muscles are relaxed and now you lie on your back, that's when people start having those kind of apneic events or airway issues. And you can see it on a sleep test. That's what I look at. I look at position. So now kind of diving into the pillow is we were looking at a lot of people that were using our mouthpiece and they were doing great until they got on their back. So one of my best friends is an ENT. We were treating a friend. He was doing great until he got on his back or the supine position. So my friend's like, well, let's tell him to put a tennis ball in his t-shirt or get these things on Amazon where you can put them on your back. And every time you roll over, it'll kind of wake you up and, kind of push you on your side. But I'm like, that makes no sense because it's going to end up fragmenting their sleep.
Yep. So now you're just not making
I literally took a piece of paper out. I'm like, Jay, what about if we made a pillow? He's like, well, what would you do? And I drew it out. My buddy ended up 3D printing me like a big version. And I made our first version of the pillow. And then I met my partner, who's an Air Force veteran, who also was in the sleep space. He worked for Serta Simmons. He's like amazing. His name's JD Valella, and he is like a savant when it comes to like sleep. And he's got a great outlook on it because he's like, think about it. You go buy a $5,000 mattress. No one's ever taught you how to sleep. You just get on the mattress. And his whole thing is like, our company, we're not a pillow company. I mean, that's our first product, but we really want to be like a sleep and a science company and really educate people on sleep and how to sleep and the different adjuncts they can use for sleep. But the pillow's been incredible. I'm actually doing a clinical trial right now, and we're sleep testing people to get a baseline. And then we're having new users that have never used a pillow to see that type of getting statistical significance to see if we can get their numbers to improve just by the pillow.
That's amazing. And you've got lots and lots of case studies already with the pillow, which is called Open Air Pillow, right? So just sounds open, OPEN, air, AIR, and pillow, PILLOW. So at Open Air Pillow, they can see what this looks like, but we have them in our house. I bought a bunch of them. So, we all sleep with them. And I'll say the kids, especially, they're like, oh my gosh, these are so comfortable. Like they love their pillows. And you're right. So the pillow is specially designed so that it keeps you on your side. And just walk through the audience a little bit about why that's important again. No, I know it's all about the tongue, but just more.
No. Yeah. So the thing I was saying was your body is going to kind of toss and turn in the middle of the night. I have to be honest, I didn't think the pillow would work as well as it does. And it wasn't even that. It was like, it's the same premise as our mouthpiece. You have to get into bed and you have to be comfortable. So our mouthpiece is unbelievably comfortable. It literally kind of like molds around your teeth. It heats up from your body temperature. The same thing with the pillow. I looked at all these other products where there's these wedges or these things you have to put your arm through. We're like, all right, how do we make it simple and make it really comfortable? So the premise was I wanted to create a fulcrum. So when your head goes down, the back part pops up so you can't really roll on your back. What we were talking about before is when you roll on your back, your tongue falls back and gravity takes over. So sleeping on the left side or right side, but as long as you're not sleeping on your back or your stomach.
Yes.
So the fulcrum, I tried all this weird stuff where I put stuff over the pillow to try to create this to basically when your head goes down, the back part pops up. And eventually what we did was there's an internal chamber. So the head part will always stay soft and the back part will always stay firmer. And then what I do is I start with it against my back, and in the middle of the night, I end up rolling over and hugging it. So I'm never flipping the pillow. My body is just moving anyway in the middle of the night. It's just a matter of what position I'm going to get in as long as I stay on my side.
Yeah. Okay. So it's really there to encourage you to stay on your side, but also the way the fulcrum works then encourages that whole that whole movement. And I'll call it like a support, right? Because the way the pillow comes down the back, it almost provides a support. So you're not, rolling onto your back. So I absolutely love this. I mean, it is really about how do we figure out things that are simple and easy that people don't have to add something else into their day, that it can just become part of their day. So let's take a step back, just kind of using your expertise. So we know we can get a mouthpiece. We know that we can get the pillows, which I encourage all of our listeners, of course, to do. Tell us about some other things just from your background that are important to help encourage people's healthy sleep.
So I will tell you this, especially being in the orthodontic world, I love talking about orthodontics and anatomy and jaw position, but it all starts with nasal breathing. It all starts about being better breathers. In this country, we breathe way too fast. We overbreathe, we hyperventilate, and we're mouth breathers.
Yes.
And I think that every patient I see, child and adult, that has an airway problem, the first thing I go to is nasal breathing. So I have everyone use a neti stick, and I have them use that for try to do 10 seconds twice per nostril. It's just Himalayan sea salt. Have you ever seen those?
A neti stick?
Yeah.
Okay, so explain for our listeners what a neti stick looks like.
So it looks like a Vicks vapor stick. It's like an inhaler. So what I do is I plug up one nostril, I inhale, try to get 10 seconds per, and it's just a way to kind of try to help and open up my nasal passages. Then what I'll do is I'll lubricate the inside of my nose with sometimes just normal saline. And then the third thing is at night I use intake, which are they look like breathe right strips on steroids. And it goes right on my nares, and it's just a way to kind of open up my nasal passages when I sleep. So that's the first thing that I kind of talk to every adult and even some kids about, just like, let's kind of focus on nasal breathing. Okay. And now I was just, the other hot topic, and I get asked this question all the time, is mouth taping. You've heard about this thing?
My son brought some mouth tape. He's putting the stuff on his nose and the tape on his mouth. And I said, we're going to ask Dr. Martin all about that.
Yeah. So the mouth taping is a way to promote nasal breathing.
Sure.
The way I kind of convey it to a lot of my patients is 3M micropore tape, one piece here to here. I don't like someone taping their whole mouth shut. I don't love people just going right to bed with mouth tape. I would tell people, if they're going to mouth tape, do it for a week. Don't sleep with it. Go home. If you're going to watch TV, if you're going to read a book, just try to get used to that, right? A couple of hours. And then if you feel comfortable, one piece, upper lip to lower lip. That's it. And that's just same thing, a way to promote nasal breathing. The second factor in it is soft tissue. So it's tongue, it's soft palate. Kids, it's tonsils and adenoids. So a lot of what happens is when I see a child that has an airway issue, so the kids, I always say, kids should be three things. They should be calm, quiet, and dry. So calm, no hyperactivity. Quiet, no noisy breathing or snoring, and dry, no bedwetting or drool. So if your child is snoring, you have to get them either to a pediatrician, pediatric ENT, pediatric dentist, or an orthodontist. They have to get seen. That is not normal. In terms of kids grinding their teeth, the same thing, right? Because we were talking about it. Why do people grind their teeth? People say stress. My argument to that is that the 4-year-old have a tough day at the office. So no child should grind their teeth either. Yes, will some kids outgrow that? Absolutely.
Yes.
A lot of those kids, though, they're struggling to breathe. So when in my residency, when I would see a kid and I knew had an airway problem and I would address it with the parents, some parents are in denial or they just don't know. So if I knew and I was like, hey, do me a favor, could you just walk into Johnny's bedroom and just video him sleeping? And once they saw it, they're like, oh my God, what do we do?
Yeah.
because that's a huge problem, especially in this country. Like, it is not cute for your child to snore. No way.
So you and I have spoken about this before, because I think the trend is not to even begin to look at things like orthodontics or Airway or things like that until their kids are much older. But that's not your recommendation. Can you share with us a little bit about your recommendation?
Sure. So your brain is almost fully developed by the age of 5.
5.
Right? The ADD, the ADHD, a lot of that is sometimes those kids are just not getting enough oxygen to their brain. And I see a lot of kids that are on stimulants, a lot of kids.
Yeah.
And it's not that easy to get those kids off of those meds.
Yes.
So when I see that, my first referral is to a pediatric ENT. I want to rule out the soft tissue problem, the tonsils, the adenoids, the mouth breathing. The second thing is, a lot of times, and it's controversial in our field, I'm all on board with it, because what happens is early intervention orthodontics helps a couple of things. Your upper jaw, a lot of times our upper jaws are too narrow. So transversely, widthwise, we're too narrow. That's the palatal expansion part. The other part is, embryologically, our lower jaw grows after our upper jaw. So when you start looking at kids, their faces are very convex. We were talking about it before. Their lower jaw is too far back. We gotta get their tongue out of the back of their throat. We gotta get their tongue moving forward. So in my ortho program, where I went at CTOR in Hoboken, we were seeing 5 and 6-year-olds and doing things like palatal expanders, doing things what we call lip bumpers or functional orthodontic appliances to kind of really promote that type of growth pattern.
Yes.
And it's really important to intervene early. I get pushed back a lot from other people in our industry. But I think we're right. You know, there's literature on it, there's research on it, but if it's not taught in the schools, it's not going to really be adopted. And that's really the biggest problem, is I think our education. Because for me, it was the same thing. I never knew about this stuff. Mm-hmm. And I made a ton of mistakes as a practitioner. You don't know what you don't know. So I never walk in and blame the dentist or blame whoever's treating the patient. It's just a matter of making them aware of it. It's the same thing. You know, I just had this discussion. There was obviously the polarity of what happened politically in our country. And it's, you know, everyone always is like, no, you can't think like this, or you need to think this way. My thing is always like, I want to understand why someone thinks the way they do.
Yeah.
And when I see a patient and I talk to another practitioner, I never think I'm right. I just want to understand why the practitioner wants to treat that patient that way.
Yes.
And it's the same thing. If a parent brings their kid, I'm like, listen, this is what I would see. You can bring your child, or as an adult, you can go to 10 different dentists and they will tell you 10 different things. I know what works in my hands and works in my practice, and I've seen it.
Yeah, I love that. I mean, yeah, we've got to think outside the box. We've got to be open to hear all sides of things and then be able to make our own decisions. I think that is the key to making any kind of progress. Otherwise, we're just doing things because that's the way they've been done versus doing things with intention and purpose.
Yeah, and the other thing is, you brought it up. I have a kid's version of the pillow that's coming out probably by the first of the year.
Yeah.
Because I was like, all right, you know what? Like, why not make a kid's version? I never heard of a kid's version, but I was seeing all these kids that were struggling. And I'm like, yeah, listen, maybe the pillow could help these kids. So the kids version is really anyone 5 feet or below. I did all these measurements from kind of shoulder to waist. And my whole thing with the pillow, and it's why I'm so passionate about it, is everyone's already sleeping on a pillow.
Yes.
Everyone doesn't have the luxury to go see you as an amazing healthcare provider, or go see a dentist or an orthodontist. But if a pillow can help someone sleep better, decrease their snoring, keep their airway open a little bit more, to me, that's a home run. And I think also, obviously, the part of our, you know, we're donating a lot of pillows to active duty and veterans. It's kind of part of our brand, especially my partner and I are veterans. Like, And that's the plug, I would say, for our pillow. But it's access to care. This whole thing is access to care. And if we can collect data and make it about really improving people's sleep, improving their airway, improving their health, why not?
Yeah, absolutely. I love that. All right, Dr. Martin, what final words do you have for people in terms of their sleep and their care for their sleep and their airway?
So the thing I would say is we all want to try to get, especially adults, 7 to 8 hours of sleep a night. It's got to be quality sleep. You need to wake up refreshed. And very rarely do I hear that from anyone. That's kind of what I want to change. I want that person to wake up and be like, pop out of bed and be like, I'm ready to go at it. And I think that, listen, those people might need a CPAP. They might need a mouthpiece. I don't know what it is, but we have to address it. And it's got to be part of I think every single adult over the age of 50 should get a sleep test. It's the same thing where I think every adult, over 45 should have a carotid ultrasound. I think it would save a lot of people from having, heart attacks. It's something that's not covered on a regular, medical exam. And I think that addressing sleep as a real important pillar of health is really, really important. And I think now it's great because we have a lot of pro athletes talking about sleep. There's tons of companies about like pillows and mattresses, but what I would tell you is this: it's more about the pillow than the mattress, because it doesn't matter the mattress. I could sleep on the floor with our pillow and get great sleep. So I think people need to start looking at that industry a little bit differently. And I think that the comorbidities, if you're having the issues with that, you're snoring, you're tired all the time, the brain fog, I would talk to your physician about it, talk to your dentist. The reason that I educate so many dentists is that it's a real captive audience. People see their dentist more than they see their physician. Yeah. And the clenching grinding thing is a red flag. And I think it's something, if your listeners are hearing that and they're doing it and they've had kind of a night guard, they need to go a little bit deeper on the sleep part with their dentist. Okay. Great words of wisdom. Great words of wisdom. So I think it's important for us to really note the importance of our sleep and start to pay attention to what's happening with our airway. What are we doing while we're sleeping? Are we actually sleeping, or are we in this stressed out fight or flight state, as you mentioned? And then if we are, then we need to remove ourselves from that environment because of the cascading impact that it has on our health. And the other thing I would say is sleep hygiene. We didn't even address that. That's like a whole other lecture of what you should do and how you should leave the bedroom. There are so many things involved. The two things that I would say are the most important, especially for your listeners, is temperature. You got to sleep in a real cool environment. So 68 degrees is probably ideal, 68 to 70, and regularity. So go to bed and get up the same time, no matter if it's Monday or Saturday. Yes. Those are two of the most important things. No sleeping till noon on the weekends. No, you can't recover that. Yes. Yeah, it's true. You want to keep your body in that rhythm, in that cycle, in that flow. Yeah, absolutely. Thank you. Well, tell us, Dr. Martin, where can people learn more about both your appliance and the pillow? Yeah, so airvada.com and then openairpillow.com. And then you could share my email with all of your listeners. It's LayneMartin @openairpillow.com. All right, Layne Martin at openairpillow.com to get your pillow questions answered. And we'll certainly have that in the links for this podcast as well, so they're able to go and look that up. I am thankful to have you here this evening, sharing your knowledge and educating us, even though we're not just dentists, but a vast variety of audiences looking for everyone to get healthy. And with that, everyone, we thank you for joining us. This is Dr. D
reminding you to tune into your body, reconnect with what matters, and embrace the journey to true wellness. If you enjoyed today's episode, be sure to subscribe, leave a review, and share it with someone who's ready to redefine their health. Let's keep redefining wellness and empowering change together. See you next Thursday for the next episode drop.